Good afternoon, or good morning, or even good evening to everyone, and welcome to today's webcast on participating in the 2021 CAHPS Home and Community-Based Services, or HCBS CAHPS Survey Database, What You Need to Know. My name is Dale Schaller, and I'll be moderating our session today, which is presented by the Agency for Healthcare Research and Quality, or AHRQ's, CAHPS User Network. Next slide, please. Today, we have three main objectives, and the first is to introduce the Home and Community-Based Services, or HCBS initiative that is jointly sponsored by the Centers for Medicare and Medicaid Services, or CMS, and AHRQ. We'll also be discussing the HCBS CAHPS survey itself, and then reviewing the new HCBS CAHPS database, the benefits of participating, and how to go about doing that. Next slide, please. So before we begin, I just want to sort of walk through a few of the standard housekeeping details to make sure that the webcast is a good experience for everyone. And the first is to know that if you're having any difficulty hearing the audio from your computer speakers, you can always change the audio selection so that WebEx calls you back and connects through your phone instead. And if your computer freezes up during the presentations, you can always try to log out and log back in order to refresh the page. And most importantly, if you need any help at any time during the webcast, you can use the Q&A feature that I will show you on the next slide. So at any point today, as we go through the presentations, you can ask a question, and we encourage you to do that by using the Q&A feature shown here on your screen. And it may look a little different depending on your browser, but the basic idea is to be sure that the drop-down option displays all panelists so that when you ask a question, everyone on our team can see it. And when you do that, we also ask if you're willing to share your name and your organization, your role, so that we sort of know where you're coming from. I will say that today's session is being recorded and that a replay of today's webcast and the slides that will be used will be made available in the near future on the CAHPS website. Next slide. So we really have a nice lineup of speakers today, starting with Karen Ginsberg, who directs the CAHPS division within the Center for Quality Improvement and Patient Safety at the Agency for Healthcare Research and Quality. From the Centers for Medicare and Medicaid Services, we have Melanie Brown, who is a technical director in the CMS Division of Community Systems Transformation. Following Melanie, we will have Kathleen Woodward, who is a managing consultant with the Lewin Group, who works on the HCBS CAHPS initiative under contract to CMS. And finally, we'll have Michael Carruthers, who is the CAHPS database lead for the HCBS survey at WestAd. And WestAd is the prime contractor to AHRQ for the CAHPS database. And again, I'm Dale Schaller. I'm a member of the CAHPS team, serving as your moderator, and now turning this over to Karen Ginsberg. Karen?
Hi, everybody. I'm excited to welcome you to this webcast and to bring you this program today to describe the collaborative work between AHRQ and CMS. So this work first started with the development of the HCBS Consumer Assessment of Healthcare Providers and Systems, or CAHPS survey. And this survey development effort, which was funded by CMS, it worked in conjunction with AHRQ and the CAHPS team at AHRQ to ensure adherence to the CAHPS design principles and testing standards. And based on their work, AHRQ was able to grant the use of the CAHPS trademark to this survey. So we're now collaborating with CMS on a database to house the HCBS CAHPS survey data and to provide a secure platform for you to submit your HCBS CAHPS data. You'll hear more about this, but you'll receive a custom feedback report and be able to compare your CAHPS scores to the identified summary of all the data submitters and access a research database online. And even if you choose not to submit data to the database, because this is all a voluntary effort, you're still going to have access to the summary database report. So before we turn to the main event, to the main speakers in this program, I just want to tell you a little bit about the Agency for Healthcare Research and Quality and the CAHPS program and how CAHPS fits into the mission of the Agency for Healthcare Research and Quality. So can I have the next slide, please? Thanks. AHRQ's mission is to improve the life of patients by helping healthcare systems and healthcare professionals deliver care that's safe, of high quality, and high value. And AHRQ is a science-based agency. We're a research and development agency. And so what we do to fulfill our mission is to invest in research and evidence to make healthcare safer and improve quality and improve healthcare quality. We create tools for healthcare professionals and to use to improve care for their patients, and we generate measures and data that are used by providers and policymakers and researchers to improve performance and evaluate the progress of the U.S. healthcare system. And it's important for AHRQ to push our science to implementation and to get our tools and our products out to you, our users. So we spend a lot of time on making sure our products are user-friendly and that we advertise them and train on them. So the next slide, please. So about the CAHPS program, CAHPS, again, Consumer Assessment of Healthcare Providers and Systems, and it's a program to advance our knowledge about patients' experiences with their healthcare. And I want to just spend a little bit of time explaining what patient experience is, because that's what we measure. And I'll be comparing this to patient satisfaction, which we don't measure. Patient experience refers to whether something actually happened to a patient or how often it happened. It's an objective measure that you can use for quality improvement. You know where there might be an issue to work on. It's whether something did happen or how often it happens. Patient satisfaction is how patients feel about their care or their health plans or their interaction with the healthcare setting. And those feelings are based on what a patient's expectations were for that care. It's not actionable in the same way for QI in the same way that patient experience question is. So we're measuring patient experience. So I just want to make sure everybody understands that. Can I have the next slide, please? So the CAHPS program conducts research to further our knowledge of understanding patient experience, how to measure and collect CAHPS data, how to report CAHPS data, and QI using CAHPS data. And we've done a lot of work on this recently. If you're interested in all of these areas, please look at our offerings on the CAHPS website, the AHRQ CAHPS website. We're most known for developing our surveys and related materials to assess patient experience in healthcare settings with health plans and providers. And we also developed, as I mentioned, voluntary databases for CAHPS survey data for selected CAHPS surveys. Next slide, please. So again, the CAHPS surveys measure patient experience, not satisfaction. They capture the patient's voice in development and testing of the survey. They measure what patients tell us is important to them, and we ask patients, they tell us what's important to them, and that's how questions end up on surveys. We use standardized methodology and research findings to develop valid and reliable surveys. And also, I just want to mention that the patients who respond to these surveys are sometimes the best and sometimes the only source of the information that we ask. I want to mention that the CAHPS surveys are trademarked. The trademark's held by the Department of Health and Human Services and operated by AHRQ, and the trademark recognizes adherence to the CAHPS design principles to ensure that measures are comparable across settings or health plans or providers or programs. And my last slide, please. Just a couple of uses for CAHPS surveys. CAHPS surveys are used for value-based purchasing, public reporting, accreditation, quality improvement, and research. So I'm going to, again, thank you for attending our webcast today and turn this over to Melanie.
Thanks, Karen, and thank you for inviting me to present today. I am Melanie Brown. I'm a technical director at CMS within the Division of Community Systems Transformation, which is in the Disabled and Elderly Health Programs group. And I'm going to be sharing more about the Home and Community-Based Services, or HCBS CAHPS Survey, Just as a refresher, the HCBS CAHPS survey was developed to support states with quality assurance and improvement by identifying areas that need improvement based specifically on the HCBS participants' experience, and then allowing for the comparison of home and community-based services across states, programs, and populations. The HCBS CAHPS survey is the first Medicaid experience survey that's been tested and validated for use across HCBS programs and for all the different populations that are served through HCBS programs. Next slide, please. So I want to start by just briefly reviewing the HCBS quality framework. Then we'll get into more specifics about the HCBS CAHPS survey itself. So the three programmatic aims of the HCBS quality framework are to ensure safety and well-being of people receiving home and community-based services, to promote high quality and accessible HCBS, and to promote value-based care and services for people receiving HCBS. Now, those aims are achieved through certain actions, and they include measuring quality and outcomes, analyzing data, tracking and trending data, internally and publicly reporting on quality and outcomes, detecting and responding to individual and system level problems, and promoting improvements in quality and outcomes. So the hope is that by focusing on these areas with the programmatic aims in mind, we'll be able to achieve improved experience of care, greater independence, health, well-being, self-determination, and community inclusion for participants, as well as achieving more cost-effective and appropriate care and services. Next slide, please. So CMS has 5 quality strategy elements that support the framework. The HCBS CAHPS survey supports the measurement and assessment of these elements. And those 5 elements are promote the development and use of standardized, validated, and meaningful quality measures, align, coordinate, and address gaps in federal and state measurement, reporting, and monitoring requirements, activities, and systems, develop, implement, and support use and availability of a comprehensive set of quality improvement, quality assurance, and technical assistance strategies, activities, and tools, improve oversight and enforcement, address gaps in regulations and oversight or enforcement, and better support states to comply with federal regulations, policies, and guidance. And 5, support development, testing, and implementation of value-based purchasing and alternative payment models. Next slide, please. So now we're going to focus a bit more on the actual HCBS CAHPS survey. As I said earlier, the HCBS CAHPS survey was developed to support states with quality assurance and improvement by identifying areas that need improvement based specifically on the consumer's experience, and then allowing for the comparison of HCBS services across states, programs, and populations. The HCBS CAHPS survey is the first consumer experience survey that has been tested and validated for use across HCBS programs and for all of the different populations that are served through HCBS programs. So as opposed to the measures you would normally see on a satisfaction survey, CAHPS measures consumer experience. So for example, it asks participants about what they actually experience on the day-to-day basis. What services did you actually receive? How often are certain things happening or not happening? That kind of data provides more of an objective picture of how well service plans are being followed. Next slide, please. So the survey is meant to be administered by an interviewer, either in person or over the phone. The choice is up to the participant. The survey is not meant to be administered by mail or online. And as long as they're not a paid provider, assistance from proxy respondents, such as a family member or a close friend, that's allowed. The HCBS CAHPS survey contains a maximum of 69 core items, depending on the types of services used. The survey contains 9 questions asked to the participant to determine which type of service they use, and it ends with a set of 15 demographic questions. Many items in the survey are preceded by screener or gate questions asking if the participant actually used the services that are addressed in the items to follow. And if the participant responds to the screener question by saying that they didn't use that service, the skip logic is employed, and the interviewer would then move on to the next section. There's also an optional supplemental module that contains 21 items about employment services, and that really focuses on job coaches. Next slide, please. So the survey does have two options for response types that the participant can use. The standard option includes never, sometimes, usually, and always as response options. But if those options, for some reason, are not easily usable by the participant, the interviewer can also choose to have the participant answer either mostly yes or mostly no. Next slide, please. So now some key features of the HCBS CAHPS survey. The survey also collects information about the extent to which the services the participant receive are person-centered, the extent to which they prioritize what's important to the consumer, and the extent to which participants can direct and control their own plan, as well as how their services are delivered. And that is critically important feedback for states and programs to gather, and it helps them to see how well their efforts towards adopting person-centered practices and approaches in service planning and delivery are working, and what kind of a difference it's making in program participants' lives. The HCBS CAHPS survey was developed with input from a wide range of stakeholders, and it was tested through the CMS Testing Experience in Functional Tools, or TEFT program, by 9 states that participated in TEFT. At the conclusion of the TEFT demonstration, the survey was formally adopted into the CAHPS trademark program. So it comes with all of the benefits of being a part of that suite of tool would entail. CAHPS is a trusted brand that's familiar to providers, it's publicly available, and users have access to high-level as well as one-on-one technical assistance as needed. Finally, the survey is applicable to field in both fee-for-service and managed care programs. This is critically important as more states adopt managed long-term services and supports. And this allows all the plans operating within a state to be compared to one another or aggregated to provide a picture of what's happening across the state. For managed care plans using the survey, they can measure the quality of their services across the state in which they operate. And we'll hear more about the CAHPS program from Karen Ginsberg in a few minutes. Next slide, please. So the unit of analysis in this context is the unit for which the survey results will be produced and reported. The unit of analysis should, in this case, be the accountable entity. The accountable entity is the operating entity that's responsible for managing and overseeing the specific HCBS program in a given state that's being assessed. So although Medicaid HCBS programs are administered by state Medicaid agencies under various legal authorities, the programs frequently are operated by other entities, such as the county or other non-state governmental agencies or managed care plan. Because the accountable entity can vary, the unit of analysis may differ from situation to situation. Next slide, please. So some other important considerations. At the conclusion of the TEFT demonstration, round 1 of testing, 19 composite measures of quality that were derived from the HCBS CAHPS survey were endorsed by the National Quality Forum in 2016. Most developers put their measures through a rigorous process long before NQF considers them for endorsements. NQF's careful review and assessment gathers input from stakeholders across the healthcare enterprise and develops consensus among those stakeholders about which measures warrant endorsement as the best in class. Also important to note that AHRQ, along with its contractor, WestStat, manages the HCBS CAHPS database, which offers free access to aggregated results for analysis and use. And the Lewin Group provides technical assistance to states, managed care plans, and groups that are using or interested in implementing the HCBS CAHPS survey. Next slide, please. And now I'm going to turn it over to Kathleen Woodward from the Lewin Group.
Great, thank you, Melanie. My name is Kathleen Woodward. I'm a managing consultant with the Lewin Group, and I'd like to share and remind those that have adopted the HCBS CAHPS survey or are in the planning stages of a few resources and technical assistance opportunities available to you. Next slide, please. On this slide, you'll see a list of different links that will be available when the slides are posted online. For more information, you can find a wealth of resources on the AHRQ CAHPS website, as well as on medicaid.gov. We have technical assistance documents available, such as a technical guidance document, frequently asked questions, example scripts for interviewers, the survey instruments in English and in Spanish, and more. The resources include best practices for surveying, sampling, and improving response rates. We'll be uploading the updated TA materials on the website in the next few months. You can also contact HCBS Measures at lewin.com for individualized technical assistance related to the HCBS CAHPS survey administration. Technical assistance is available to states, managed care plans, and other HCBS CAHPS users. Next slide, please. On this slide, you'll see that we just wanted to let you know about some additional upcoming HCBS CAHPS events. We'd like to invite you to continue attending or to join our early adoption work group meetings. Our next meeting is scheduled for Monday, June 7th from 2 to 3 p.m. Eastern Time. The early adoption work group is for interested states and managed care plans. We invite anyone who has implemented the HCBS CAHPS survey or is considering HCBS CAHPS as an experience survey for your Medicaid HCBS programs to join this work group. The work group has met twice so far and will support the adoption and successful administration of HCBS CAHPS survey across states and managed care plans, support data analysis, data aggregation, and participation in the HCBS CAHPS database, identify and promote best practices in HCBS CAHPS survey implementation, and support the continuous quality improvement of HCBS. We also have information about Lewin's next 2 quarterly HCBS CAHPS webinars that are available for your reference in July and the fall of 2021. When the slides are shared, you'll be able to click the link to register, or you can also subscribe to the HCBS Measures listserv emails, and we'll be sending out links for the upcoming events in the coming weeks by emailing hcbsmeasures@lewin.com for additional details about what we'll cover during the webinars and for the registration information. If you have questions related to HCBS CAHPS technical assistance or suggestions, please email the HCBS Measures mailbox that I just mentioned. I'll now turn it over to Michael Carruthers at WestStat to tell you more about the broader CAHPS database.
Yes, thank you, Kathleen. Good afternoon, everyone. The CAHPS database is next slide, please. We can go ahead and progress. The CAHPS database is the central repository of data from the health plan survey, the clinician and group survey, which does have reporting data but has suspended new submissions, and as of early 2020, a repository for CAHPS home and community-based services survey data. The database is designed for 2 major applications. The primary purpose is to facilitate comparisons of CAHPS survey results by and among survey users to assess performance, and the database also provides de-identified data for research purposes. Participation in the database is voluntary and open to all users, and the database is funded by the Agency for Healthcare Research and Quality and administered by WestStat through the CAHPS user network. Next slide, please. The HCBS CAHPS database is a collaborative initiative between the Agency of Health Research and Quality and the Centers for Medicare and Medicaid Services, CMS. The database will facilitate these comparisons of HCBS CAHPS survey findings by individual states and HCBS program types. And again, participation is free and open to all states and managed care plans on a voluntary basis. The next data submission period opens in October of this year. Next slide. Some of the benefits of participation are any data submitter will receive a customized report that compares their state or managed care plan and individual program type results to the overall HCBS CAHPS database results. And that data will also be included in our other reporting products, which we will discuss a bit further on an upcoming slide. And free technical assistance is provided to data submitters and users of the reporting products. Next slide. The HCBS CAHPS database online submission system opens once a year in October. Organizations that are interested in submitting data just need to complete 4 very easy steps. The first step is to register for an account, where we ask for some general information regarding the state or managed care plan. Step 2 is the state or managed care plan needs to provide a signed data use agreement, which specifies how the data will be used and stored. The third step is, prior to data submission, we request a copy of the survey instrument used, where it is reviewed to ensure it adheres to CAHPS standards. And we would encourage submitters to send their survey instruments to the HCBS CAHPS database prior to data collection if possible. And the final step, step 4, is that the state or managed care plan survey vendor would need to provide a data file that has been formatted to CAHPS database specifications. Next slide. The CAHPS database produces 4 distinct reporting products. There is an online reporting system where users can view and download reports, a private feedback report that is only provided to submitters of the database, which compares a state or the managed care plan's results to the database average, a chart book which displays summary level database results, and we also make available research data sets that are de-identified data files that can help researchers answer questions related to experience of care. Now, I should note that some of these products may not be available, as they are dependent on the number of the volume of data we receive. So we encourage states or managed care plans to submit data to ensure that we can provide all of these products. Next slide. This slide shows an example of a private Excel report that would be received by a submitter to the database. And again, these reports are provided to submitters upon request. And the report shows how a particular state or managed care plan performed compared to the overall database averages. Some items shown, such as the database average and significance test, are dependent on the amount of data received to be included. Next slide. This slide also shows an example of how data may be reported in the online reporting system. An overall composite score and scores for the individual questions that comprise the composite measure would be displayed. Next slide. I just want to speak a little bit about data confidentiality. HCBS programs can be assured that their data are kept confidential and that no program names or other identifying information is ever made publicly available. Only aggregated program data is ever publicly reported. And next slide, please. And as I mentioned earlier, the CAHPS database team at WestStats offers free technical assistance with data submission issues, responding to questions regarding data specifications, and the data submission process. And we also offer assistance to any user with our public reporting products, such as the use of the online reporting system and how to obtain and use the research data sets. The CAHPS database team can be contacted at the email address HCBS CAHPS database at westat.com and at our phone number 1-800 or 855-580-4657. And thank you very much, and I'll turn things back over to Dale, our moderator.
Thank you so much, Michael and Kathleen and Melanie and Karen, for that really excellent overview of the program, the survey, and the database supporting HCBS CAHPS. We've reserved quite a bit of time here for your questions and answers. Let me just remind and encourage you again to use the Q&A box to type your questions submitted to all participants so that we can see it. And we'll get started with your questions. So Michael, you were last up. I'm going to start with you with a question with respect to the data that are submitted are de-identified, but do they have indicators for the states and or programs that they refer to. And this is from Gabrielle Katz.
The reporting products, including the research data set, are would be available depending on the amount of data received, as I mentioned earlier. But at this time, I don't believe we would have plans to include any identifiers that in the data set that would allow linkage to any claims or other encounter data, if that's answering the question, hopefully.
Well, in the future, depending on the volume of data received, will there ever be a display of individual identified states and programs, or is it all pretty much going to be by program type?
We're expecting that we would display results only by program type, not identifying any individual programs or state agencies, and that the data would be rolled up to an overall state level.
Got it. Great, thank you. So Melanie, there are a couple of questions that have come in with respect to what is required or not on the part of states or programs. The first question comes from Sandra Maldonado, and she asks if they, and I am assuming this is a state or possibly a HCBS program, are required to notify either AHRQ or CMS that they don't have any patients to send a survey to. She indicates that they're a startup. They're in the process of attaining Medicare and or CAHPS accreditation.
Thanks, Dale. And so there is no current requirement that states or any entity implement or field the HCBS CAHPS survey. It's completely voluntary. So no, is the answer to your question. There would not be any requirement for you to notify CMS or AHRQ that you don't currently have patients to fill the survey.
Okay, thanks. There's another question regarding, I don't know if this is requirements, but expectations. And the question is whether the idea behind HCBS is to replace what's called the MHSIP survey. I'm not quite sure what that stands for. Maybe you do, Melanie, with HCBS. The questioner, Cindy Helstad, says that it seems like HCBS would be more inclusive of consumers without state or county funding, and whether or not this is on the government's radar.
So again, the administering the HCBS CAHPS survey right now is 100% voluntary. States can elect to use this as one of the tools that they're using to assess the experience of care for their HCBS population, but it's in no way at this point mandatory. So it's not intended to replace any of the state's current tools at this point.
Okay, got it. Thank you. Kathleen, there are a few questions that have been submitted regarding the use of the survey, administering the survey. This question again comes from Gabrielle Katz, and she asks if there's a way to determine how much proxy involvement there has been for each survey.
That's great question. So survey sponsors or vendors who had participated both in the pilot or that may be administering the surveys currently, they often indicate who responded with help from a proxy. So at a state or program level, they'd be able to calculate that number. We don't have the specific data on how many responded with the proxy help, but just as a reminder, proxies may be used, and a proxy is someone who answers on behalf of the program participant and represents the participant's experiences, not his or her own experiences. And then if a participant chooses not to participate, the participant's wishes would be honored and no proxy would be used. And so proxy may respond for the participant when the participant agrees and is willing to participate, but is not able to respond to the questions. And that's where Melanie was talking about how unpaid family members, friends, or neighbors may meet this criteria, but proxies may not be paid providers of the participant services.
Okay, thank you so much. That was a very thorough answer. There's another question that I'm going to direct to you, Kathleen, again from Gabrielle Katz, who is asking about if there's any evidence to date based on the HCBS survey data that's been collected regarding how well the demographic questions have been collected or filled out, particularly related to ethnicity?
So again, we don't have the specific individual level responses to be able to provide that response exactly. But I would say that there have been many surveys that are completed, and most states have reported a high completion, and that includes responses to their About You section, which asks about race and ethnicity. So there's questions included in the survey. Are you of Hispanic, Latino, or Spanish origin? And then there's other questions that'll ask, what is your race? And it drills down into which group best describes you. And those are in the About You section of the demographics.
Got it. Melanie, I'm going to direct this question to you because it relates to any requirements that may exist for users of the survey to work with a vendor or organization that has been certified. Is there a list of certified vendors? Can you comment on what the requirements are, if any, with respect to using a survey vendor and their certification?
Sure. So as I said earlier, use of the HCBS CAHPS survey is voluntary. It's not required or necessary to use a vendor to administer the survey or to submit survey data. The CAHPS database is also open to all organizations that are able to follow the submission requirements. At this time, CMS does not approve vendors for the HCBS CAHPS survey. It is possible for the survey data to be collected by in-house staff of a state agency or other sponsor or through a commercial survey research organization. Regardless of which approach is taken, there are some basic competencies that must be present. So for example, the data collection effort requires the data collection entity to have computer-assisted telephone interviewing and or computer-assisted personal interviewing capabilities. Just in terms of how states would go about sort of identifying a survey vendor, states will need to decide sort of how to accomplish the data collection, but there's, if you do decide to do in-house or to utilize an external vendor under the contract, your in-house data collection could involve using existing state employees, or you could hire contract staff. At this time, there's no recommendation by the Centers for Medicare and Medicaid Services for programs or states to conduct a survey, and as a result, there's no standardized recommendations or approved survey vendors.
Got it. Thanks so much, Melanie. So Michael, I'm going to come to you now with a couple of database related questions. The first has to do with the research data set when it does become available, or can you talk about what is available now with respect to the number of states, how many respondents, et cetera?
As of now, we've had very limited participation in the database up to this point. So I don't have hard numbers on number of participants, but we will be looking forward to being able to produce public reporting products in the near future after the next data submission period. At this current point, we are only providing, as I mentioned in the presentation, private Excel reports to the entities that have submitted data this current year.
Okay, so no research data sets until there's a more complete set of data that have been submitted by users of the survey. And I think, one of the key messages of this whole webcast is to encourage users of the HCBS survey now and in the future to submit their data to, basically avail themselves of the benefits that you described. All of this is very derivative of there's, it's kind of a two-way street. The database will become more useful to the extent that users submit data. And so we're really relying on the user community to make that possible. One other question for you, Michael. When the data become more complete and available for producing research data sets, will the de-identified data set include For example, the demographic indicators regarding racial, ethnic characteristics of respondents?
Yes, current plans are to include the typical case mix adjustment items that would include racial and other age and other demographic information. That's correct.
Mm-hmm. Okay. So I'm going to continue to encourage all of you to continue to submit data, or your questions, excuse me, for the CAHPS database for HCBS and/or issues related to survey administration. Michael, let me just stick with you for a few more minutes with respect to the opening of the database in 2021 in October. How far back will you accept HCBS CAHPS results to be uploaded as part of that submission?
As we had mentioned, we're still actively, encouraging submission to the database and trying to see this database as it is a new endeavor. So current plans are to accept data as far back as July 1st, 2017, up through December 31st of 2020, if it has not been previously submitted.
Very good.
And again, this is just into an effort to create as a robust database as possible, and again, be able to produce the reporting products, as you mentioned, such as the research data set.
Got it. I think this question has been, in a sense, answered implicitly, but let me pose the question to you, Kathleen. Is there any cost of using the survey other than the actual cost of administration?
The survey is available to states and managed care plans at no cost from CMS. And so the tool right now, you can go to medicaid.gov on the website and be able to download both the CAHPS survey as well as the employment module. And then the costs that we've found that have been associated is just related to administration. So there might be startup costs associated with a vendor, or just staff time to program the survey into a CADI or CAPI system. And then again, for any data analysis that might be required as part of your quality improvement plan.
Thank you. And Karen, there's a question I think suited for you with respect to the accessibility and use of the survey outside of the United States. Can it be used by other countries? And this comes from, I think, one of our participants from the United Arab Emirates.
Thanks for asking that question. As you know, there is a big use of CAHPS internationally, actually, or the surveys that we produce as CAHPS surveys here are very widely used internationally. And I think in order to use this survey internationally, I think you have to really think about, how, whether it's applicable to the program that you want to measure, and because the survey was developed and tested for use in the United States and only for U.S. programs. So I would ask first if it's applicable to what you need to do. And if you want to use it or do your own translation for international use, you'd have to ask AHRQ for permission. I've never seen a situation in which anybody's been denied permission, but if you write to our technical assistance program at CAHPS CAHPS 1 at westat, westat.com, they can help guide you through how to ask permission or and get you started on that process. But yes, it's available for you to use. Just I would urge caution and making sure that the questions and the concepts are appropriate to your particular situation.
Mm-hmm. Very good. I have a question here related to the use of CAHPS data, and I'm assuming this is specific to the HCBS CAHPS survey. I'm going to direct this to you, Melanie. Are there any examples, or can you imagine in the future any examples of how the data collected with this survey might be used in value-based purchasing models? This comes from Laura Vegas.
Yeah, I did see the question, and I'm not thinking of anything off the top of my head. I would encourage you to submit this question though to the mailbox, because we can look back at some of the work that was done during TEFT and see if there are any specific examples of states who use the CAHPS data for a value-based payment model.
Mm-hmm. And it is clearly true to the extent that CMS in other programs related to other settings of care like hospitals and health plans, CAHPS data have been used and are currently being used in value-based programs. Okay, I want to just again encourage people as we wind down toward the end of our hour to continue to submit questions. We had a few that were submitted in the registration process. I want to just pose the question with respect to what we know, given the uptake to date of the survey about response rates. And I believe, Kathleen, this is a question that you will be able to field in terms of the use to date of the survey. What kind of response rates are people seeing with the survey?
I just want to caveat that data is still coming into the HCBS CAHPS database, so response rates as we have more information will be available. But what I can speak to is the testing experience and functional tools response rates. Just in general, response rates for most surveys of older adults and adults with disabilities tend to be relatively low, and response rates for the testing have been about 5 to 30% for the HCBS CAHPS survey, but they may be higher depending on the state that had performed the testing. And then during the HCBS CAHPS survey testing in 2016, Connecticut reported a 63% response rate across HCBS programs. And when you're thinking about the response rate, survey users should consider past experience administering other surveys within your HCBS program and with those participants. So there might be other strategies you might want to consider for maximizing response rates, either using promotional communications, such as a pre-notification letter that you'd include on state letterhead or your managed care plan letterhead, as well as informing case managers so they can verify the legitimacy of the survey, making calls to schedule the interview appointments, and making several telephone call attempts, as well as allowing for proxies to respond. So those are just a few of the examples, and then more information can be found on the Medicaid.gov HCBS CAHPS survey webpage.
Great, thanks, Kathleen. So Melanie, there was a question that came in earlier regarding the ability to add custom questions to the survey. Can you comment on what sort of guidelines are in place for adding custom questions to HCBS CAHPS?
Sure. So we do advise that survey users be very cautious about making any modifications to the HCBS CAHPS survey. The survey can only be modified in very specific ways and still be eligible to maintain the CAHPS trademark and participate in the AHRQ HCBS CAHPS database. Users can send their survey with proposed supplemental items to the AHRQ WESTAT team prior to administering the survey to make sure that the survey would still be eligible for use of the CAHPS trademark and inclusion in the HCBS CAHPS database. You can write to them at hcbscahpsdatabase@westat.com. Just a little bit more information about that. Questions should not be asked out of order, and question text and answer options shouldn't be deleted or altered. Survey users can, though, tailor the survey by adding questions after the core questions and then immediately before the About You demographic section. I would encourage you to reach out if you have additional questions about this. You can contact the CMS HCBS Measures team to discuss specific modifications that you're considering at hcbsmeasures@luan.com.
Thank you. Karen, I'm going to ask you the question that's been posed regarding any comparability that you can comment on between the HCBS CAHPS content and skilled nursing facility CAHPS. Is there ability to do any sort of comparison of those two survey instruments?
There are, I'm assuming you're referring to the nursing home CAHPS surveys, and
So.
there are 3. Is that right?
It doesn't specify.
For,
yeah, I think you should assume that.
Yeah, there's 3 nursing home surveys, one for long stay residents, one for short stay residents, and then one that measures the family members' experience in the nursing home connected with their relatives, their family members stay in the nursing home. So those are 3 surveys. And while I think that there are probably questions that are comparable, I think the settings are very, very different, and the populations that they're measuring and are different as well. And so even if there's content that overlaps, the settings are different enough that I would encourage you to use the survey in the setting that you're most concerned with. One thing that the HCBS survey and the long-stay nursing home surveys have in common are in-person administration. Those are the only 2 CAHPS surveys that have that recommend for in-person administration or interviewer administration. Mm-hmm. So those are that's a unique feature of both of them, unique to the CAHPS world.
Mm-hmm. Thanks, Karen.
Sure.
A question here that I'm going to direct to Melanie. I'm going to try to interpret the question as from Hannah Klein, who is asking about whether this survey and its requirement is similar to the core question. I'm assuming the core set possibly required or compiled for Medicaid programs, because the question has to do with if the data from this survey are submitted, does that in any way sort of qualify as participation for a Medicaid program on the core set? I don't know if that's something that's in your sort of wheelhouse to answer, but I'm going to give it a try.
So again, use of the HCBS CAHPS survey is completely voluntary. There is no CMS requirement for states or other entities to use it. So use of it would not result at this point in any additional rate in terms of payment for Medicaid.
Yeah. And I can confirm that in terms of the current version of the core measures for adult Medicaid programs, this particular survey is not part of that core set. That gets updated annually, so stay tuned. You know, I think we have run the table on the questions that have come in during the webcast and those that were submitted via the registration. And with that, I'm going to ask for us to move toward sort of the wrap up. And a number of questions have been posed that might require sort of ongoing communication and sort of being able to receive information from both AHRQ and CMS regarding program updates, CAHPS news, things about webcasts, submission timelines, et cetera, other products. We want to encourage all of you to sign up for this email update program that's managed by AHRQ. And the way to do that is to go onto the CAHPS site and look for email updates in the upper right-hand corner of the screen. And you basically hit that and you choose from a number of programs to receive information. And you would be selecting CAHPS, the Consumer Assessment of Healthcare Providers and Systems, to get ongoing email updates on various programs, including HCBS and the HCBS CAHPS database. And if we can move to the last slide, we've given this information out throughout the course of our webcast today. But if you have questions, if your questions did not get answered, or you have questions that occur to you after the webcast concludes, we encourage you to email the HCBS CAHPS Database email box at HCBS CAHPS Database at westat.com. We have a 1-800 number, which is 1-855-580-4657 if you prefer to be in touch by phone. And of course, the website, which is www.CAHPS that's database.ahrq.gov, which you can come to at any time and look for information and updates regarding this survey, the database, what's available, timelines for submission, the requirements of submission, and any other questions that you might have about participating in the database. And with that, I guess I would just want to again thank all of you for participating in today's webcast, and especially Karen and Melanie and Kathleen and Michael for your presentations. We hope that you do stay in touch with us and continue to field your questions, and we will do our best to answer any requests for information that come our way. And with that, I'd just like to, on behalf of AHRQ and CMS, thank you all again. And this will conclude our webcast today, and wishing you all a great rest of your day.